Fang-Ching, and I'm a dietitian in Taipei Tzu Hospital in Taiwan. And today my topic is exploring factors associated with compliance with CKD-specific low-protein supplements among CKD patients. For CKD patients, we all know that nutrition plays a very important role because most of them have to eat low-protein supplements every day. But there are some reasons for them not to eat the supplements. So I want to find the reasons and resolve them. And in the following slides, I will introduce our hospital meals for you because our hospital meals is very special than other hospitals. And then I will introduce the results of my survey. Because Tzu Hospital is a Buddhist hospital, so our hospital always the vegetarian meals. We provide lactose-off vegetarian meals. It means we only provide milk and eggs. We know the meals we provide no meat, no poultry, and no fish. Here are some characteristics in our meals. Such as we serve locally grown vegetables, and we serve at least one portion of green vegetables per meal, and we serve at least 2 other colored vegetables per meal, and we serve various options of grain choices like white rice, brown rice, and noodles, and Chinese buns. We call it mantou. Okay, and here's the sample pictures of our hospital meals, and you can see the characteristics I just mentioned in last slide. You can see we serve the green vegetables and other vegetables. And these meals actually provide to the CKD patient, and you can see we provide high-value protein such as soybean products. And because our hospital is very special, there are 200 volunteers in our hospital every day. They help us to care patients and their families. So we also serve our meals for them. It's also a vegan meals. And here's the sample pictures of our hospital meals for postpartum care mothers. In traditional Chinese, the postpartum care mothers have 2 sitting months. It means they have to eat more calories and proteins for their body recovery. And we serve 3 meals and 3 snacks every day. And you can see the calories is about 2,200 to 2,000 to 500 calories every day. In our hospital, we also have a vegetarian food court for patients, their families, and outside customers and our employers. And in our food court, you can have vegan cafeteria with over 100 dishes per meal, and you also can have hot pots, noodles, traditional Taiwanese food, and Japanese-style food, and Korea-style food, and more. Here is our vegetarian food court, and you can see many people. There are 3,000 people pass through our food court every day. And here's our vegan cafeteria, and we serve many kinds of vegetables. And the food price is depend on the food weight. Okay, and this picture is taken in lunchtime, so there are many people, and we also have many kinds of counters. Okay, and because in our inpatient we can serve adequate nutrients for them, but for outpatient, we cannot ensure their nutrient even if we have a food court. So we want to do more for our outpatient. But you could ask me why we focus on CKD outpatient. Because CKD outpatient could have a protein energy wasting risk. So we want to do more for the CKD outpatient. And this slide shows the causes and the consequences of protein energy wasting. It's easy to realize that if you have the dietary nutrient intake is one of the causes of protein energy wasting risk. And protein energy wasting will result in infection and cardiovascular disease and so on. If the CKD patient has insufficient nutrient intake, they will in protein energy wasting risk. So dietitians have to do more for the group CKD patient. We all know that CKD could divide it into 5 stages according to the DOCI guideline. And at first, I want to introduce the CKD situation in Taiwan. And you can see the people in stage 2 and stage 3 are more than other stages. And stage 2, the proportion of stage 2 is about 3.8%, and the proportion in stage 3 is 6.8%. And the proportion in men has higher risk than women. And this figure shows the prevalence of CKD. And we can see over 65 years old, the people has the higher risk. So we have to do more for this group patient. And this slide shows the prevalence of ESRD between different countries. And you can see Taiwan is higher than United States and Japan. And this is not a good thing. And this figure shows the incidence of ESRD between different countries. And the incidence rate has the same trend. From the incidence the Taiwan government want to resolve this problem. So they build some strategies such as they publish the uncomfortable truth, and they let TSN and BHNI and NHI work together, and they prohibit erythronoic acid use. It's Chinese medicine. And they push intensive care program, include pre-ESRD, early CKD patient, and they also push multidisciplinary care. And the nutrition intervention is in intensive care program and multidisciplinary care. Our intensive care program has many members like nephrology nurse, and dietitian. We do medical management and lifestyle modification, and we will regularly follow up their laboratory data. And here's our plastic models for educating patient the portion size. Because we know the protein is the necessary nutrient, but CKD patients have to limit their protein intake. So patients on low protein diet often have difficulty to meet their nutritional requirements. And enough calorie is very important. So this kind of patients will be advised to eat more calories. So they will be advised to use CKD-specific low-protein supplements or healthy oils such as olive oil. And in the following slide, I will introduce some low-protein supplements. And these commercial low-protein supplements in Taiwan, this kind of supplements is easy to calculate the calorie need for dietitian, but it's not suitable for all kind of patients because the taste is not very well, and the price maybe is is a problem. And these are some sample pictures of Taiwanese traditional low-protein materials. You can see this is cornstarch and the sweet potato starch and tapioca and sago. And we will make some recipes for our patient to make the low-protein food. And these are sample pictures of Taiwanese traditional low-protein salty food. And this kind of food can easy to buy everywhere. And most of our patients will eat them as meals. Because the protein content is lower than rice and noodles we usually consume. And these are sample pictures of Taiwanese traditional low-protein sweet food. And most of our patients will eat this kind of food as desserts. Even though there are various low-protein supplements options for CKD patients, even though there are various low-protein supplements options for CKD patients, in my experience, some of them cannot to eat them every day. So we want to know the compliance and if the current education is suitable or not suitable. I think it's a part of nutritional therapy. So in 2012, we investigate the CKD outpatients compliance with the supplements. The objective is to find the factors which are associated with the compliance. And the method? Until 2012, there are 1,053 CKD patients with stage 3 and to stage 5 in our intensive care program. And all of them has consulted dietitian once or many times. And they get back to hospital for follow-up every 3 months. Half of them were recommended on the CKD-specific low-protein supplements every day. And we checked 477 patients for the low-protein supplement used by telephone interview. And if the patient didn't use the supplements every day, and we will ask them the reason. And then we classify the reasons and the results. And after the telephone interview, we found 125 patients didn't eat the CKD-specific low-protein supplements every day. And we classified the reasons into 8 items. Include patient had unclear concepts, patient were affected by their families or live alone, patient dissatisfied with texture or taste, preparing meals were inconvenience for patients, and patient forgot to eat supplements. Patient has side effects after eating supplements because some patients think that after they eat the supplements, they will vomiting or diarrhea. And patient had no appetite recently. Maybe he had a cold. And patient had financial problem. In the first place, and only we can do is to enhance their concepts. But it is surprised the second place, patient were affected by their families or live alone. So from the results, we can know that family support is play a very important role. And it's a pie chart of CKD stage and age of non-compliers. And we can see the age over 65 and equal to 65 years is about 70%. So from the results, if we want to that the patient has better life quality, we have to think about that. If the patient have family support or current education model is suitable or not. So this year, we built an education model. We educate the low protein. We educate the low protein recipes not only for the patient themselves, but also for along with their families. If the patient live alone, we will invite them to attend the activities, and the activities will hold 3 months. Every 3 months we'll hold again. And this is the photo of activities in May. So in conclusion, for CKD patients' renal protection, we have to do is to resolve their reversible causes of CKD, such as diabetes or hypertension. And Taiwan's strategies is in progress. For dietitian, the most important is nutritional therapy. We have to educate low protein diet, and we should provide CKD-specific low protein supplement education services, not only for CKD patients themselves, but also their families. I think their families will be the pusher in the nutritional therapy. Okay, thank you.
It was an excellent presentation. I'm just wondering, because as you said, you are providing the vegetarian meal to all CKD patients. Regarding the potassium, how you manage the potassium level?
Sorry, can you explain your question again?
I'm asking that, as you said, you are providing the vegetarian meal to the CKD patient. CKD patient. Yeah. And how you manage the potassium level? Mostly vegetables, they are the rich, good source of potassium. Some vegetables, some fruits. I'm just wondering about that.
钾的含量。You mean how I manage their potassium content?
Yes.
Because my survey, you mean in our hospital?
Yes.
Okay. Actually, we don't, because CKD patient, we have to limit their potassium content. Everyone, we don't limit their potassium content because we have to check the serum potassium. If the serum potassium is too high, we will to wash and boil the vegetable to reduce the potassium.
So your selection for those patients is that the vegetables or fruits which are less in potassium, you have to recommend them. You are recommending?
Yes.